everyone. Welcome again. This is Nicole Yo-Fisher, one of the clinical educators at HIN. We're going to go ahead and get started with our full clinical portal webinar training today. So I'm going to go ahead and also I'm going to write a note, but just a reminder, if you have any questions, to go ahead and type them into the chat box, and I will be responding to folks. But I'm going to hand this over to our other clinical educator, Sharon Barrer.
Hello, everybody, and welcome to our education webinar series. I'd like to start by welcoming you all, but to let you know that everyone on this call may have a different level of understanding of what the clinical portal is and how it works. Some of you may have had some training by either myself or Nicole at some point. Perhaps some of you have used the older clinical portal and haven't been really updated on the newer version. And maybe some of you have been using HealthInfoNet right along, but you're on today to see if there are any new bells and whistles that may help you work with your patients. So please know this may be pretty basic for some of you who already have used it. And so I am going to do a pretty much of a full type of a training. So by the time this is over, it does take about an hour, depends on how fast I talk and how many questions we get. You should hopefully leave by saying I feel very comfortable about finding data on my patients. Nicole will also send everybody information. Is that correct, Nicole? Do we send them something at the end, like the user manual or the PowerPoint? So you'll be getting more information if you have to step out during the presentation. So let's get started and stay in the know is the title of our presentation today. I want to make sure that you do have my email, my phone number, and know that if someone in your organization wasn't able to make today's presentation and you think that they would like to have some training, or your office or several people, please reach out to us. This is what we do. We train, we either go to your site or we do a webinar. We want to make sure that everyone that has access to using the clinical portal is trained and feels very comfortable about using it regularly. So our objective today is to demonstrate an understanding of the health exchange. I think it's really important to know where the data comes. How does it get to us? What if it's not there? What does that mean? We also want to make sure that you understand how to access the clinical portal, either through the URL that is sent to you as a new user, or perhaps if you're an Epic user, it's a parameter-based launch, which means you can get directly into the clinical portal from your EMR, and to understand and to develop knowledge of the skills to navigate the clinical portal. As a nurse myself, I've worked in many organizations where if it's a pain to navigate something, I'm not going to go into it. I'm not going to take the time to do it. And I want you to be able to get in easy, view the data, and this all obviously to enhance patient care. So, what is HealthInfoNet? As you know, HealthInfoNet operates the main statewide health exchange. And these systems are designed to facilitate access to and to retrieve individuals' clinical information to create better, easier, and obviously safer care management, collaboration, and coordination of care. If some of you have used it, you realize that it's a lot easier to go on the exchange and look for an MRI that was done in a different facility versus having to take the time to call, leave a message, wait for them to call you back, then wait for the report to come on the fax, but the fax needs more toner, there's something that's wrong. So this is how it's supposed to really make it easier and better for you. HealthInfoNet is a nonprofit. We're the organization that is governed by a voluntary community-based board of directors and an advisory committee, and we run the HIE for the state of Maine. And the members of the organization are medical providers, public health organizations, patients, government agencies, and businesses throughout the state. So they're all shareholders that are involved in what we do and making sure that what we do is the right thing for our community of healthcare providers. And we provide a number of services to our participating provider organizations. And we do this through our clinical portal, which is what basically you all have access to, and real-time event notifications. Now, some of you know about the notification program and tool that's available for you embedded in the system, but maybe some of you don't. So if you don't, please send us a chat with your name and that you'd like more information on notifications. I don't go into a lot of details today on that, but I will share what it does, and it might get you interested in knowing more about that. We also do public health reporting. We work with the CDC. We do predictive analytics measures as well as syndromic surveillance. So we do a lot of things. We're very busy here in our office at Pineland Farms, and hopefully what we do helps you. So how it works is the system combines information from healthcare sites to create the electronic health records. This comes to us from your medical records, electronic medical records. And we have a secure connection from your EMR to us, and we standardize and aggregate it so the information on your patients are readily available for you in the portal. And once fully processed, patients' health information is provided back to the exchange, and the portal and real-time event notifications are available, public health reporting, and again, like I said, predictive analytics and more. So who participates with the HIE? Well, we have more than 790 provider locations throughout the state of Maine. That includes the 35 hospitals. A lot of people don't know that number, so and every single hospital is connected. But we're also connected not only to the hospitals, which are either the tertiary or the critical care access, but mental health hospitals, ambulatory facilities, behavioral health facilities, and FQHCs, our federally qualified healthcare centers, our post-acute care facilities, nursing homes or SNF units, as we call them, also the VA sites. We have reference laboratories, health systems. We have emergency medical services connected, as well as pharmacies and some payers. So what's included in the HIE? You'll see this as I go through demonstrating the navigation of the clinical portal. But just quickly here, you'll get labs and radiology reports, allergies, meds, encounters, where the patient has been. So users throughout the state, it really varies. The highest utilizers are RNs, medical assistants, the people who need that information to help the providers provide direct patient care. But we also have a lot of hospitalists, care managers, emergency room, VA staff, clinicians. A lot of people find that with this data, they're able to really provide quality patient care. So let's move on to the overview of the clinical portal at this point. I'm sorry, I thought I was going to go in and start navigating, but I guess I'm not right now. We're going to talk about a little bit about common interventions, and you probably already know this. How you're going to use this is emergency rooms use it a lot in walk-in clinics because they don't follow these patients that walk in. They don't even know who they are. They may be visiting in the main area that they're going to the clinic. So what a great way for them to look at information that they know nothing about this patient. But care management, population health nurses are some of the highest utilizers. It's also really good to work with chronic condition management because some of our highest utilizers of the emergency room are those chronic condition management patients. who just end up in the emergency room when they're falling ill. Med recon is always a big problem with a lot of providers who can't seem to get their patients' medications information readily for them. And for quality metric reporting, obviously identifying gaps is really important. So again, I'm not going to take too much time in notification training today at all. It is usually like a separate program, but I do want you to know that it is a program that is embedded in the system that you have access to that allows you, particularly if you're a population health nurse or a care manager, you want to know if your panel of patients might be seen somewhere outside of your facility. So we're able to send you an email in real time that patient may be in another facility's emergency room, or they might be being discharged from a big tertiary hospital that you didn't even know they had gone there. So by doing this, this really helps you to follow through the patient, do transitions of care, and sometimes maybe prevent a hospitalization by reaching out to the patient. So if you are, again, interested in knowing a little bit more about that, send an email to Nicole, or not an email, but a chat, or give us an email. That's another way you can reach us, and we'll talk about that. We are connected to the VA, so I'll show you that information when we get to that in the clinical portal. And so now, this is the slide where I show the demonstration of the clinical portal. So a lot of you are familiar with this screen. As soon as we get to it here. Thank you.
Oh, okay, good. Yeah, I am.
All right. This is the home screen, and this is, we're going to enter your user ID and password. If you have don't have an account yet, let us know. We'll make sure that we can make that happen for you. Before I enter into the clinical portal, I do want to show you a link right here. Not everybody sends us the same data exactly from the same organization. We are able to collect a lot of data, but not everyone is able to send us exactly everything. So it gets a little frustrating when you're looking for something and it's not there. Well, this spreadsheet will help you. And it's about 5 pages long. And if you want to, you can right-hand click and print this off. But I do ask that you make sure to keep an eye on the revisions here because we're updating all the time. So for instance, here is all the hospitals. And this is the data that we receive. If there's a check mark associated with the data in the organization, we get it. A check mark's a good thing. These empty boxes mean we do not receive that data at this time. So you can see we don't get a lot of EKGs. It's how it's been able to be sent to us that we're working on making sure that we can get that information to us. Now, there are some that do send us EKGs. So here's Maine Health, for instance, and then it goes down to your behavioral health organizations. So as you can see, there's a lot of dashes, which means it's not applicable. We're not going to be receiving that information, but they do send us some data that may be helpful for you. And then it goes into the post-acute organization. So there's about 5 pages. So this is really helpful for people who are looking for a particular record. There we go. All right, let's go into the test environment for the clinical portal, and I'll give you some navigation. So I'm going to log in, and it's going to bring you right to where you're going to find the patient. So this is the screen that'll show as soon as you sign in. Over here in this gray column is the menu. Now you're going to keep going back to this when you want to research a patient or look at your recent patients or look at your notification program if you use it. So this is the menu that always remains there. But this is your member search screen. Now, you're going to see 6 boxes here, but don't do anything with this box right now. This is a drop-down box that has all your organizations in it. Don't bother with that. Don't need to deal with that. Don't need the MRN right now. The best way to find a patient is by first and last name. We like to make it easy for you. If you have the date of birth, you can certainly use this handy little calendar to find your date of birth. But if you don't have it, you're in a hurry, let's just search by clicking on that link for Minnie Mouse. Now, it's going to bring up every Minnie Mouse in Maine, so make sure you do have the date of birth to make sure the right patient is being accessed. So on this particular screen, you're going to see several Minnie Mouses with their date of birth, and you're also going to see 3 columns here. The first column has an opt-out date. Now, most of you know that this is a consent, we are an opt-out program, and that if a patient opts out of the clinical portal, we do take that information and shield it so it is not able to be accessed. And if that's the case, if a patient does opt out, there'll be a date associated with that patient's name. Now, you can click on that all you want. It will not access that information for you. Now, that patient can opt back in at any time if they change their mind. And that's just a process through an opt-in form that they need to sign, have it sent to us, and then we take that information that has been blocked and put it in the exchange. The second column is mental health consent. So the consent process for that is if the patient wants their behavioral health provider's information from that organization to be in the clinical portal, readily available for anyone who needs who is a direct care provider that needs more information, they can opt in. So if there's a date there, you will be able to see behavioral health information readily. Now, there are times that the information can be viewed by a provider under 2 circumstances. That's an emergent situation, or if the patient gives you permission. And I'm going to show you how to do that really quickly. HIV consent, we do have a column for that, but we are not collecting that data, nor is it available for you to view. So let's pick a Mickey Mouse that we want that is not opted out and does not have behavioral health information available. So let's take this Minnie Mouse right here. Clicking anywhere on that line will bring you to your first screen of having to break the glass to look at that patient's data. This is to make sure, again, the right patient is being accessed by the right person, you who have signed on, and for the right reasons. So the reasons you're looking at Minnie Mouses is what you're going to be doing with this drop-down. Now, this just identifies the type of an organization that you work at. Don't have to worry too much about this. Are you an ambulatory care provider? Are you mental health? Are you a specialist? Do you do care? Figure where you best fit in to the reason. So let's say that we're ambulatory care for this particular patient. Don't bother to write anything in here. There's only one person who has to write anything in here, and that is information technology support, okay? So all of you nurses out there who have to write down a million things what you do, don't write anything there. You don't need to. Let's break the security privacy seal, and then it's going to bring in the information about your patient. You are now in the clinical portal. The only reason I'm in this particular record is that I want to show you how to break the glass. If the patient is perhaps in the emergency room and is having some type of a reaction, psychotic reaction, and the RN and the MD or a nurse practitioner wants to look and see if there's any information from the behavioral health that they need to see to help take care of that patient, you can break the glass. Or if the patient has given you permission, either the patient or someone who's either a designated healthcare POA or what have you. So those are 2 options where you can look at this data just for 3 days temporarily before it goes back to the shielded side. And that's in this big blue box here. You'll see this on every record. Certain sensitive patient information is not available. So you want to break the privacy seal. By doing that, you get this really kind of a long but very specific disclaimer. It's letting us know that you're accessing this information because it's an emergency situation. Or, again, it may be that you're confirming that you've explained to the patient or the legal rep that you want to look at this information and for the reasons why. In that case, you have to actually click this box here. You'll see there's an asterisk here. That is your action that you have done what the disclaimer says. The reason are the same exact reasons as breaking the glass prior, but again, this might be due to the emergency aspect, or it might be still that you're an ambulatory care provider and you've been given permission. Now, before I said make sure not to write any reason why you're in the record, although this is not a legal requirement, but as a risk manager myself from years ago, I know that it always, when you're doing something above and beyond, particularly when you're looking at sensitive data, it's always a good thing to put the reason why you're accessing this information. I want to remind you that we do a lot of auditing as well, and we do try to look at the auditing of who's breaking the glass, just to, again, protect our patients' privacy. So once you do that and you break the privacy seal, you'll notice over here there was some action in the document. So before, and I should have showed this to you, there was only one document, but now there's two. The second one is sensitive data. Now again, it may not have a lot of data, but whatever we have that may be helpful can be golden if you really need it. That will again be gone in 3 days back to the shielded side. So I'm in this patient's record, and I want to go to another record, and how do I get there? So again, the navigation to get to another patient is through the menu. So we've moved the menu and just toggled it behind this screen, and you get to it by these 3 lines here. So see that just toggles back and forth. So here's a demographic search. You can do demographic search again if you have never been in a patient's record, or you can go to recent patients, and this will keep a list of your last 50 patients that you have viewed. And so that if you're in a patient's record a lot, if you have 50 patients that are high utilizers and you're in and out of their records all the time, what a great place for you to go to find your record without having to always type it in. So there's the Minnie Mouse. I was just in Minnie Mouse, remember, and this little key just shows you that I have opened it. It'll be open for 3 days. This is the record I want. I'm always in an in-test demo when I'm training, but it's closed. So once I click on that, I'm going to have to break the glass, and it'll be open for 3 days. When I train tomorrow, I don't need to break the glass. So now we're in a pretty extensive record that really shows how the data can be used for you. I'm going to show you again. Here's the break the glass little box here. Below that are documents. Let me make my screen a little smaller. There you go. So here are all the different documents, and we'll talk about that in a moment. So this is the first column. Remember, the menu is here. And over here, this whole screen here that I can scroll down, that is what we call up here the patient summary screen. So you'll hear me call that the patient summary screen a lot. And there's 5 things I'm going to show you on this screen to navigate quickly. The first thing is demographics. Always good to look here if you're having trouble finding a patient. Maybe the information you have is outdated. The clinical portal may have newer, updated information, particularly if they go to another organization and give them their registration information with a new phone number, new address. It'll show up in the clinical portal. This is vital for a lot of people who follow patients who are a little transient and they go around and move around a lot. The second thing I want to show you is over here are your allergies. We have increased this to having 15 lines now. So if you do see some verbiage down here that says more or previous, please make sure that you go to the second page and look at all the allergies. So we've moved this up to have the allergies readily available for you. The third thing is your active problems. Here's your list of all of the information that comes to us from the EMR via the ICD-10 coding. And the most recent will always be on top. Now, I want to remind you, you can't break anything. You can't lose data. This really is data for you to look at, critically think about it, look at it. But the only thing you can do on this particular page, if you find there's an asterisk next to a word up here, you can hover and it will tell you who sends the data from the location, what location is it. So for instance, this is a new patient, you're looking down all the different diagnoses and you find that the patient has hepatitis. You're not aware of that, you want to know a little bit more about that. Where did that information come from? Well, it came from Wilson Stream, tells you the date it was sent to us and we received it, and that gives you the start to investigate a little bit more about your patient's hepatitis. So there's our third thing. Our fourth thing is here. It is medications. Now, medications come to us not so much from the pharmacy, but from claims data, from SureScripts. So a caveat for that means if the patient paid cash, it will not go to their insurance company to be paid, so it won't be here. And this has not really been a problem for a lot of people, though. It's been pretty good information. But as any professional, you're going to go over meds with the patients verbally anyways. But they may forget to tell you they're on an opioid, or they might forget that they didn't fill their lisinopril. This is a good place to kind of look and check so that you can just follow through the patient and do that med reconciliation, which is real important. And it's there for 120 days, and then it's deleted because we certainly can't keep all the data forever for medications for patients. And the last thing is the encounters. This is the data that we get whenever a patient walks into any facility and they're registered. So if the patient goes to the emergency room, they're registered. If they go to the hospital to be admitted, they're registered. But they're also registered if they go to PT or if they go to IV cancer therapy or preoperative for surgery. So it's going to be very clear where the patient was, the admission and discharge, the type of visit. There'll be a few more of these. This is kind of old data, so you're going to see some things, but pretty self-explanatory. The type of service that was provided. And on your record, you're going to see chief complaint, which is always good. Why did the patient go to the emergency room? The physician, a clinician that saw them. And again, here we have asterisks for your diagnosis, category, code, and procedure. Hovering will give you a little bit of information. So again, looking at this data, you can see that the patient had an outpatient visit with this particular provider, and this is why they went there. And if you want to know the location, you can certainly hover too. So this is a lot of information for you. And again, all of these have, if there's more information, if the patient has been seen in multiple places, has multiple diagnoses, always notice if it says more or previous. And this information, which we call ADTs, admission, discharge, transfer, that's the code that sends it to us. It is that information that allows us to send you a notification about where the patient is at, which hospital. And so this is important information for that notification tool as well. So that's pretty much what the patient summary will show you. You can look at it quickly. It tells you quite a bit about the patient. But over here are documents that really enhance the information that is over here. But before I go into that, I just want to kind of show you a little bit more on this particular page before we change. Is up here are 4 tabs. The first tab, as you know, it's highlighted in white because this is where we're at. The second one is for VA records. If you're looking for a VA record, that's the tab that you would use for that. My Patients is part of the notification tool. And again, you will have training on that if you're interested in getting that information. I won't be showing you that, but that's where you can see it easily. And then community services, we're working very hard to get a lot of information about our patients. And we only have at this point non-emergent transportation encounters, but we're looking at getting more things like food insecurity, being homeless, things that really help us to take care of the whole patient and find out a little bit more about them. And this is for our Medicaid patients only at this time. So that's what those tabs are. So again, you want to get back to the patient summary. That's where you're going to go to refresh your screen and be able to look at data here again. So now let's go over to all the different documents. Now everyone will have a little bit of a different layout here depending on what's sent to us about that patient. But let's just kind of look at these, and you'll notice that some are highlighted and some are not. It works just like Outlook or whatever you use for email. If I were to send you an email and you hadn't seen it yet, when you got it in the morning, it would be bold, so you know that there's a new email. You'll look at it, and then it goes unbold. Well, it's the same thing for when you sign into a particular patient. You know what you've looked at, and you know what's new. So it's just a quick way to say, you know what, there's quite a few things here I need to recheck about my patient before I give them a call and triage how they're doing. There's also, you find some numbers on the end of some of these reports here. So laboratory, for instance, is highlighted, and there's 2/17. This means there's 17 data points in this particular folder, and there's 2 brand new ones I haven't seen, so I better go in and take a peek at that. And that's what that means. So let's just take a look quickly at an emergency room visit. You know the patient was in the emergency room. You want to call the patient, but you want to see what happened first, or they're coming in right away to see the doctor. You're going to click on the little triangle and see it says it has 2 reports. Here they are. When you hover, it tells you a little bit of information, not enough really to want to make some decisions on, so you want to click on it, and you'll notice that it comes in this viewpoint here in where the patient summary used to be. So there is the full report versus waiting for it to come over on the fax machine. And if there's a print box up here, which is really kind of tiny, but you can see it, you can print it off, and that means you can either scan it on your system or pass it to someone who needs to review it. You can copy and paste and put in your EMR. We don't have a way for it to be automatically sent to your EMR yet, but let's hope soon in the future we will be able to have something as nice as that to happen for you. So there I am in my emergency folder. I know a little bit there. So now I need to look at laboratory. Let's go down to laboratory. You can see there's some highlighted laboratory. There's 2 that I haven't seen. But also you notice it's color-coded. I'm going to move this over a little bit if I can here. Okay. So you'll see it's color-coded. And again, we do that so that you can quickly look at it, quickly see how the patient is doing. So when you see black, it means those reports are normal. Yellow is there's some abnormality, better take a look at it. Or the red, of course, means critical value. So it just kind of gives you an idea if you're looking at a new patient and you can see, you know what, we've got some CBC problems here. We better check and see what's going on. Well, let's open one up. When you open up the CBC, the same thing happens. It goes over here in the patient summary. Here's the results with a patient reference range from that particular laboratory, which is always good to have. And again, you can print it off. One of the most interesting and most helpful things for a lot of people is being able to look at a lot of data, because we have a lot of data that comes in from your laboratory reports, as you know. Well, you kind of want to have a big picture of a cumulative result of a particular lab result. And you can easily do that by clicking on this particular link, View Cumulative Results. So I'm in a CBC. I'm going to click on that. And what it's going to do, it's going to break that CBC down to the different things that are included in the CBC. So I want to know hemoglobin, and I want to know the crit, and I want to know it from every single one that we have available in the clinical portal, and see if there's any trending values. Now this works really good for hemoglobin A1Cs, lipid profiles, cardiac enzyme, a lot of different things you can do this. So I've chosen what I want, and I'm going to graph it. Down here is the graph button, and then it's going to actually graph. Now I only have 2 data points here, so it's not as pretty as it could be, but you might have all different kinds of curves and things going on here, so you're able to really kind of look at it. And a good thing, if you get a lot of little dots here, if you hover, see if I can hover on one of these, it'll tell you quickly a little bit more information. So where it came from, what the date, you know, just a little easier for you to go through it that way. This can be printed off as well. It's a good patient tool sometimes for some people. So I showed you laboratory. We've got immunizations. We've got microbiology. We've got operative and diagnostic procedures. Outpatient radiology. Please know that radiology is not like a PACS. It's an actual written report by a radiologist. And know that we don't do or don't generally do preliminary reporting. It would just be so much data. So a stat wet reading of a chest x-ray may not be available right away. You have to wait till it is read and then signed off. Once things are signed off, it is there for you. So I'm in this place and you go, my goodness, how do I get back to see what their meds are, because I forgot to find out whether they're on a particular meds. Remember, you're going to click up here on this tab, and that's going to bring you to your summary. All right, I'm going to now show you a wonderful tool that sorts things for you once you get real comfortable in the clinical portal, and it's above the documents. And we call this the document tree, but so if you hear me, call it that. Above the document tree is this little box right here that says Document View. By using these icons here, you can change how the data looks here for you to be able to sort it and look at it quickly. And you'll get used to what you need and how you best need to do it. But let me give you an example. We have a little eye here, we have a little search magnifying glass, and we have refresh. But let's click on the eye, because this is the view that I want. You can use this drop down, so you're looking for someone that you know went to the emergency room 24 hours ago, and you want to see everything in the clinical portal just that has been sent to us within the last 24 hours. So you're not going to have to go through every file and all these different files. So you may want to click on last 24 hours. Or you don't want to know the last 3 years data, but you do want to know the last 3 months. So you'd click on 3 months. I'm going to keep it at all. I'm going to look at all the data here, only because my data is old and it won't separate it that way for you in training. Now, this is how you're going to group the information. You can do it by date, which means I want to know only what was done in the last week, 2 weeks, 1 month, and you can do date. Or, again, I can't show you that in training because of my date of my data. But let's do service. And you can also break it down even more, but I'm not going to bother with that in training. I'm going to show you, once you apply those specifics, something happens here where now every place the patient has been, service is place of service. This now will sort it where you can open up everything that was done in Eastern Maine. It also shows you all the different places the patient has been. Maybe you didn't know the patient was being seen in an ER in a different part of the state. So that is a really good way to be able to sort what you want. Another way to sort, again, when you click on the eye, I want to do provider. Again, I'm not going to do anything by sort by, but I'm going to apply provider, and then it will show me all the different providers that the patient has seen, and underneath that particular provider will be, what did the provider sign off? What data was sent by that particular provider? And please know, it might be a radiologist, a pathologist. It may not be an actual provider with direct patient care. but that's all the providers. And then you can do a date, like I said, but it will go to default back to category, and I'm going to refresh the screen. Whoops, I have to apply it first. You don't break anything when you make a mistake. You have to just keep moving back to where you began. Let's do search. This is what most people use, I find, is that with a search function, works just like trying to find something on Amazon, right? Go into the search function, and you want to see a colonoscopy because that's a lot of things we're looking for. Start spelling it, and it'll just bring up colonoscopy. And this works really good because sometimes the colonoscopy reports are sent to us to a different folder. So instead of having to look through 3 different folders, this will pull it up wherever it is within the clinical portal. And you just start. I'm going to do a CBC because I want to know this patient has a CBC. It'll bring up quickly your CBC. Now, if you're looking for something specific, like the EKGs, remember I said we don't collect a lot of EKGs. I'll be putting that in because it's a preoperative. There's no matching items found, means we do not have an EKG on this particular patient. And again, we're going to refresh by doing our little refresh here. And we're back to our clinical portal. So the only other thing I'm going to show you by toggling over, remember this is our menu, is that this is where the notification tool is. And so if you want training on that, I'll show you more on that. But over here on links is our up-to-date, which is an evidence-based research data bank that you can look up information quickly if it's a new med you're not familiar with. Instead of having to go online or find it somewhere else, we have it directly from the clinical portal. And I think, hey, I'm giving you some time back. Unless people have some questions, we could certainly answer some questions if you have, but I know I went quite fast. When we do webinars, there's not a lot of room for a lot of questions, so I'm not interrupted. So I think it's great that we were able to do this and give you a little bit of time back. Did I forget anything or need to, Nicole, do you think?
Nope, nobody had any questions on chat. If anybody, I guess we'll, in the next minute here, if anybody has any questions, if you want to press *6 to unmute yourself, you're more than welcome to do that, and we can answer questions. I will say that I will be sending everyone an email, as Sharon mentioned, with the clinical portal user guide, just so folks have that, which is a real easy read, and it goes through each of the areas that Sharon did discuss today. So if you're looking for more information, you can just hold that, have that handy if you need to refer back to it. But if nobody has any questions, I did also want to let folks know that yesterday afternoon, HealthInfoNet users did receive a newsletter from us. So if you do have a user account and we have your email, we sent out a newsletter which includes information about our upcoming webinars. And for more information, including the event registration on these sessions, you can visit our website at hinfonet.org, hinfonet.org. If you have any more questions, I will hang out on the chat here for about 5 minutes or so. So if folks do have further questions and you want to hang out for a minute, I'll be available to do so. But otherwise, as Sharon said, we can certainly give you some time back in your day, and we really appreciate you joining us for this webinar. Thank you.